Welcome back. We were talking to our guest today, Silvana Kadir Sinha. She is the CEO and founder of Bravo Health, a unique healthcare brand in Bangladesh. They provide the kind of services that our National Health Service provides in the United Kingdom. It's mostly consultation and treatment. They don't have hospital beds, not yet, but they do provide consultations and consultations of a very high caliber. What I'm worried about is that in Bangladesh, most of the city centers and the urban centers, they have a lot of. Are you there?
Yes, I'm here.
Great.
Thank you.
We were talking about the large number of hospitals and clinics in cities, particularly in Dhaka, but a lack of an appallingly few numbers of hospital, or there are government hospitals, but private clinics are hardly there. How to address this? I notice you sitting in New York, your healthcare center in Dhaka, but I'm sure that you are in touch with them all the time. And have you, with other private sector entrepreneurs?
Actually, I'm only in New York because I got stuck here because of the pandemic, but I'm usually based in Dhaka.
Okay, right. So have you, with the cooperation of other private sector entrepreneurs in this sector, are you planning to start something for the rural population, which don't seem to get any health care at all?
So actually, I think that there's a little bit of a misconception here. There are actually really excellent clinics in the rural setting that are often administered by NGOs such as BRAC and others. And as I mentioned, I think this is how Bangladesh has
but that's very basic.
So dramatically.
That's very basic.
They are very basic, but they are the reason that Bangladesh has been able to improve maternal, newborn, and child mortality rates much more dramatically than our neighbor, even India. And so I don't think it's fair to undermine the great work that they have done, actually. Although you're right that there is improvement to be made, but I think we should also recognize the really excellent progress that has been made. I think when you compare Bangladesh and India, I think a big difference is that in India, in the cities, you can access some of the best care in the world. But in the rural setting, it's arguably some of the worst. In Bangladesh, it's really not that bad in the rural setting. The problem is it's not much better in the urban setting. That's not to say that across the board we have improvements and progress to be made. I think the challenge is that when it comes to someone who wants to access, there are long wait times, there are long backlogs. Certainly, the system is stretched, and the best doctors in the country don't want to live in the rural settings. 75% of our doctors actually live in cities, and 65% of our population lives in a rural setting. Right. So there are certainly challenges. But I think it's also important to recognize the progress that's been made and some of the great work that has been done in the rural setting.
Coming to this pandemic, COVID-19, how have you at Bravo Health handled this? What was your role?
So as
apart from testing positive and negative.
Sure. As an outpatient provider, we've been very focused on trying to continue to treat non-COVID patients so that they can avoid flooding the hospital system. And with respect to COVID patients, I think I mentioned earlier, we've introduced some tools for remote management of COVID positive patients, which in most cases can recover on their own without having to access hospital care. So 86% of the patients who've come through our system who've tested positive through the remote tool that we've piloted actually do not require accessing any hospital care, compared to only 49% nationally. And so, again, as we have done before, trying to reduce people from having to access hospital care, we're continuing to focus on the same things. We're also doing a lot to raise awareness. There's a lot of confusion around the virus. As we know, even the best scientists in the world are making new discoveries and developing their understanding of the virus every day. And so we're trying to keep our patients and our communities apprised of the latest information, the latest guidance. What does it mean to social distance? What does it mean to care for a loved one who's been diagnosed with COVID? How can you actually treat them at home, without exposing yourself? How do you protect your children? How do we protect patients who have high, like, possible comorbidities, such as diabetes patients, heart patients, asthmatics? And so we've been trying to really raise awareness around those areas as well. We also partnered with the government initially on on telemedicine. So we've set up a free hotline. Anyone in the country can call it. If you call 10648, anyone in the country 24 hours a day can call, talk to a doctor, to ask some of your basic questions around the pandemic and around COVID and how to protect yourself. We partner with the government on their free 333 hotline to offer services in that regard as well. We've also been working with corporate clients, certainly, who are trying to bring workforces back online, to help them with testing, to help them to raise awareness, to help them to understand what they can do to protect their workplace and protect their employees as well. So we've been very busy. As you can imagine, all healthcare systems in the world are stretched during this time, and we've been no exception to that.
When people call you, you said that there are hotlines. When people call you, who fields those questions? These are paramedics, the doctors?
We have medical officers who are recent graduates who are trained according to, Brava's protocols, and in some cases, our senior doctors are also manning those hotlines.
Are you thinking of extending or increasing the number of patients that you can handle, or providing extra, like one in Chittagong, one in Rajshahi, one in Khulna, one in Jassur, something like that?
We would love to do that. As I mentioned, we're currently raising funding to try to expand our network throughout Dhaka and beyond. So if anyone wants to fund us to achieve that end, we'd love to partner with you.
How many patients can you handle in a day? I know patients come with different
well, it depends on the size of the
requirements.
clinic, right? So it depends on the size of the clinic, and it depends on what you mean by handle. I guess in terms of the number of patients who can come through the clinic, that's one thing. We also have virtual care offerings. We also do home sample collection. We have test offerings. So we can actually process more than 20,000 tests per day. In terms of actually being able to consult with a doctor or see a doctor, we can handle a couple of thousand a day.
Coming to the $60 million questions, how affordable is Brava Health? The consultations, the services provided by you.
It's affordable, so it certainly doesn't compare to the government service, which is nearly free. You have to pay a nominal fee to access government service. The private facilities, most of them are quite expensive. So we like to situate ourselves in between the overpriced private facilities and the overstretched public facilities. So to see a doctor, basically to see a family doctor, it's about, I'll say it in Dhaka, 600 to 1,000 Dhaka, depending on the specialty. And the test pricing also varies, but it is comparable. To see a doctor at one of the private hospitals or clinics, in most cases, starts at 1,200 Dhaka. So we are pricing ourselves basically substantially lower than that.
You mentioned earlier that a lot of people go abroad for health care, and a lot of money, hard-earned foreign money earned through RMG and foreign remittances is lost on that, see. So it would be a very good idea. I mean, I feel personally that with people in the private sector and others, as I raised before, and the government should cooperate and establish facilities inside the country so that people do not have to go abroad for medical care. Also, the people in positions, you understand what I mean, should not be going abroad for medical care, for minor medical cares, because then it does not provide a very good example to others, that means others will follow them, and then they go abroad and also spend the hard-earned foreign exchange that Bangladesh needs. If you want to spend money, why don't you spend on healthcare system within the country? Then people will not go abroad.
I certainly agree. I certainly would echo that. I think that it's actually a question of dignity. I think that Bangladeshis deserve to be able to access world-class healthcare within their borders. It should not be necessary to leave your country for that.
Have you also thought about establishing a medical school of quality? Because we have so many.
Absolutely, I would love to. I'd love to do that. I'd love to do it. I'd love for someone else to even come and do it. I think there's a need for all of us to fill in different gaps within the ecosystem. And there is a need for not just medical. I think that there's a big focus on doctors, but I mean, I think you mentioned earlier that there is a shortage of doctors in the country, and a lot of people focus on that. I'm not sure enough focus is given to the fact that actually the nursing and technician shortage is worse than the doctor shortage. In most countries, the human resources are structured like a pyramid. You have the most number of technicians,
Right.
then the next number of then the next number of nurses, then the next number of doctors. Bangladesh is a reverse pyramid. You have the most number of doctors, then the next number of nurses, and the lowest number of technicians.
We have
This is
an
a severe
inverted
challenge
pyramid.
for our system. We have an inverted pyramid, and it's a serious challenge. It should not be that people need to go directly to a doctor for anything that goes wrong. Allied health professionals, nurses, technicians can help in many different ways to prevent escalation of disease. And so I think it's not just a medical school that's required. I think an entire system in terms of anything related to health professional training. So medical school, nursing school, technician training, paramedic training, health coaching. We've
Right.
introduced a health coach
Right.
concept. So I absolutely think, we would love to eventually, I mean, we do invest heavily in training in-house right now, but we've not opened up our trainings externally, but would love to go down that path in the future. We'd love to see others deepening the training opportunities that they're offering. There's a wonderful nursing school, Grameen Caledonian, launched in partnership with Caledonian University in Glasgow. It's an excellent nursing school. There need to be more initiatives like this, I think, in the country.
Well, Bangladesh is not alone that there's the shortage of nurses, because we have the same problem here in the United Kingdom. See. Because of this Brexit, a lot of people have gone back to their countries, and we have, lo and behold, we have a shortage of nurses, paramedics here. But alhamdulillah, we have enough doctors and we have enough patients, so they can go on. What other projects are you involved in right now?
Me personally?
Yep.
I'm not involved in any other projects right now.
Right.
I'm full-time, more than full-time,
Right.
engaged in building Prava. We're really working hard every day to try to earn the trust of Bangladeshi patients, and we'd like to build the best healthcare company in the country.
I was wondering if Prava could start a hospital in Dhaka with say minimum 300 to 500 beds, see, then you could perhaps show the way how to provide healthcare system in Bangladesh, because I am not very happy about the way patients are treated in these 4 or 5 very well known hospitals, because I have some personal experience. I was there, the patient was dead, and yet he was transferred to CCU for further treatment, and then we were said to come back tomorrow morning, and halfway down our way home we were informed the patient is dead. See. So that increased the bill. Apart from that, no service was performed or provided. This is very pathetic for people who are already in distress. Somebody is dying, and then they have to outstretch their meager income. That is very pathetic. That is, and where is this ethical oath that most doctors take, see, when they have to go into professions? I know it was very easy for me to say some
Yeah,
things like this.
no, I agree with you. These challenges are unfortunately happening everywhere. We're really focused on outpatient care and the impact we can have. We'd like to prevent people from having to go to the hospital. One day, once we firmly establish the concept of outpatient care as your first point of entry into the care system, we'd love to launch a hospital one day. Unfortunately, I have personally experienced stories like the one that you have as well in my family, and they're far too common. Um, the system is driven perversely by financial incentives. The patient is not at the center of the experience, but that is exactly the model that we're trying to flip on its head. You know, we're basically trying to focus on what is best for the patient. We've introduced membership plans whereby you pay a flat rate for unlimited access to outpatient services. So basically, starting at a price point of 3,500 taka, you can come see a doctor every single day of the year. And you don't have to pay anything on top of that. The idea of this is we're trying to align our incentives with our patients. And so basically, if you come every day, if you're not feeling well every day, then we have failed, right? But if we keep you healthy, if you only have to come 2, 3 times, then we have succeeded. We're aligning our incentives with our patients. I hear you on the need for better quality hospitals, but as an entrepreneur, I have to pick my battles. I have to focus on only some areas at a time. If I take on too much in my early years, then I'll never be able to achieve the systemic
That's
change
true. That's
I'm
true.
working toward.
Yes. Now that's why I was trying to explore if other members in this private health care business, they would cooperate and start something which will be like the beacon, and which will be provide good health facilities, and then others will
Well,
follow.
we're very, I would say I'm very optimistic. There's a large investment been made in Bangladesh. Apollo Hospital has been taken over by Evercare, which is a hospital system, a global hospital system that I really respect and trust. And I'm very optimistic about what they can accomplish, although their services are much more expensive than the price point that we're trying to cater to. But it's a start. We have to start somewhere, and I hope that there will be more competitors cropping up. I think it comes back to the patients. When I think about what Brava is trying to build, we're trying to empower patients to take better care of themselves and to stand up for themselves. I think the story you shared, as I mentioned, it's far too common, and I've experienced it in my family. But patients and patients' families are far too deferential, and they go along with whatever is proposed to them. Patients need to understand they have rights, and they need to step up and take it, like really take ownership of those rights and demand better care. At Brava, we offer 15-minute appointment slots. The average amount of time doctors spend with patients in Bangladesh is 48 seconds. And so, we want patients to realize they deserve better and they need to start demanding better of their system.
Yeah, but what you're talking about is health education, isn't it? Awareness. People should be aware of
Patient
what to
education.
do, what to eat, when to eat, what not to eat. But with our eating habits and with our lifestyle, if you see any picture of from any street, any market, you'll see most people are obese. They have huge bellies. They spend a lot of time uh, eating the wrong food, and they do not do any exercise at all. See, I'm not talking about a smart set in urban centers who regularly go to gym or have a treadmill at home, but we are talking about the general public, and that is where the problem lies, see. And if the mortality rate goes up, it is them who suffer, not the people who live in Gulshan, Baridhara and all that, you see. Everybody there is more health conscious than people in rural areas, see. That is where the problem is. See, if we have the right kind of education, and where will the education come from? It should be starting in the schools. I do not know what's happening today, but when I went to a school in Dhaka, there was a subject called health science. apart from moral sciences. And they taught us what to eat, what not to eat, and how many hours of exercise shall we should be spending on, and what are the good habits and what are the bad habits. If that is not taught in the schools, and people do not, the parents do not practice that, then the children would not learn from their parents. You okay with that? Do you agree?
I agree. I think patient education is needed. I think it's challenging in a country where the education system is so stretched to expect a huge level of literacy to be provided by the public and private systems. But I agree with you. I think that there's a cultural shift that is required. And to be honest, this is part of why we are focused on the middle class, because we think the middle class is in a segment of the population that's quite aspirational, that's really trying to work to achieve a better lifestyle for themselves and for their children. And they have more of an appetite for a new way of taking care of themselves, for a new way of educating their own children. And I think that that is how a lifestyle shift can be accomplished. I think that's what we've seen in other markets as well.
Well, a lot of affluent middle class people, I mean, they send their children abroad. Then they come back, they've got other ideas, and they are pretty healthy.
I'm
If
not
you
sure
look,
that, I'm not talking about the affluent. I'm talking about the pure
yeah,
middle class.
in general, if you look at the population, Bangladesh population, see, they are taller now because good food is available. They are eating more. See, but again,
Clean
as
water. There's a
you
lot of
refer to
improvements.
inverted uh, pyramid, now they are spreading, but they are spreading sidewise. See, they are not going up. See, so they are gaining weight, but in the wrong places. And that is where the education would come. And I think if organizations like PRAVA went into health education, that would make a mark.
Well, I think I mentioned, I mean, we do try to do a lot in terms of patient awareness. We send, regular content out to our patients to help to educate them. We do Facebook Lives with our doctors, with our health coaches to help to educate people. We're not engaged in patient education in a formal way in terms of schooling, but we do a lot to try to raise awareness among our patient populations. I agree with you. I think that's absolutely critical.
Health education should be made compulsory in the schools because that is where it all starts. Do you see in, say, 10 years' time, 20 years' time, Bangladesh will have a satisfactory healthcare system? Right now, we have it's haphazard, it's disjointed, not organized. We have a Ministry of Health, we have a Director of Health, a Directorate of Health, and to, I won't say shambolic, but it's not very organized. So one day, if it is organized that way, then perhaps we could have something like what is United Kingdom calls National Health Service. Because then, I'm sure you are aware that nobody is out of the pan. Everybody is inside. I am there, my children are there, my relations are there. They are all registered with a general practitioner. See, and the general practitioner, who is like a family doctor, he provides the information. He has the information. Like this morning, I called my GP. I needed a particular medicine. He asked me some questions. I said, I need the prescription. He said, where shall I send it? And I said, to the nearest chemist. After 1 hour, I go to the chemist, the medicine is there. Now, I call that healthcare service. See, I called him at 8 o'clock, at 8:30, the medicine was in my hand. See, if that kind of service we can provide, never mind we have to work hard, we have charge them the money, but at least provide the services. Don't overcharge them for something and then don't provide the service.
Sure. So I think the question, can we expect a satisfactory healthcare system, is a bit of a loaded one. I know the data on NHS satisfaction rates, and although your story is a beautiful one, I know there are a lot of people who have a lot of frustrations with the NHS as well. So I hope we can do even better, to be honest. And I think there's an opportunity for that. I think we can leapfrog. One of the things that I find really exciting about working in healthcare is that nobody's really figured it out. There are many countries in the world, and I think we've seen during the pandemic, including the United Kingdom, including the United States, including many countries across the world that have been incapable of properly responding. Although even now in the United States and in the UK, there isn't proper contact tracing in place. And there are models in Asia that have done much better, actually. If you look at Korea, if you look at Vietnam. And so I think what we have an opportunity to do in Bangladesh is to really learn from those models, take the bits and pieces that we
Right.
admire in other countries' models and bring them to our country and leapfrog. Because of the lack of regulation, which is a huge challenge for us, but it also presents an opportunity to build and innovate. And that's what we're really trying to do. The story you shared about your pharmaceutical products being ready so quickly, we're doing that at Brava now, and I think it proves that it can be done. So we'd certainly love to scale our model. There are others who are doing really exciting work in the health sector in Bangladesh as well, in smaller ways that we hope we can start to see traction, and that we can see start to scale. We also, I think, like we don't have legacy data issues that really established countries face, because there's very little digital data in Bangladesh now.
Right.
We
Yep.
have an opportunity to build a healthcare system where actually data is interoperable between both vertically and horizontally within systems. That's an amazing opportunity for patients, so that what we do at Brava, for example, right now is we have a fully integrated hospital information system. When patients come, we scan and store those medical records so that every time a doctor sees them, they can see their full history. And the difference that we have in Bangladesh that we don't have in the West is that patients own their records. It's not the system that owns the records. And I think that's a right that patients should celebrate. And when patients own their records, it gives us a better opportunity to serve them and to really invest in improving their outcomes. So I see that we have a huge opportunity before us. I think that there are real challenges. There's a lot of politics involved, of course, and we're seeing the weaknesses in our system now. But I hope that although many people have died, and no one can deny the tragedy of the current global pandemic, I hope that we can use it as an opportunity to really try to leapfrog our system and really dramatically improve outcomes for future populations.
Hopefully. On that happy note, hopeful note, we come to the conclusion of this program. Thank you very much for being with us, and thank you for giving the time. I read somewhere that you have advised some governments on governance. Did that include good governance? Because I know that some governments need some advice on good governance. That was just a
Well,
parting
I
question.
would certainly not like to think that I advise governments on bad governance. So yes,
That was just
I
a
was always
parting
trying to
question.
advise
It
them.
doesn't
Yeah,
need to be
yeah,
answered.
yeah.
I know what you
Yeah,
mean.
I did my part. I certainly have tried. I think, it's very easy to give advice. It's much harder to do the hard work and implement.
Thank you very much. Thank you very much for the time.
Thank you so
One day
much.
perhaps we'll meet, maybe in Dhaka, maybe in
I
London,
would
maybe in
love
New
to.
York.
I would love to. Thank you for having me today. I really appreciate it,
Thank
and
you.
appreciate the opportunity to connect
Thank
with
you.
you.
Have a good evening.
Thank you so much.
Thank you, viewers, for being with us, and we hope that you enjoyed the show as much as we have, and learned a little bit, at least, about how health care sector is operating in Bangladesh. And of course, there are some rays of hope. Prava Health is there, and we hope that there will be more such organizations that will look after the needs of the ailing community, if I can't say humanity. Thank you very much. Bye for now.
Thank you.
Thank you.